Good morning, my name is Nathan McLaughlin. I'm the Executive Director of NAMI New York State, the state organization for the National Alliance on Mental Illness. We represent families, peers, advocates in every corner of New York who believe that mental health is health and that every person deserves access to compassionate, high-quality care and support. Today we're here because families are hurting. We're seeing what happens when the behavioral health system is stretched beyond capacity. Long wait lists, staff burnout, and loved ones cycling through crisis care instead of receiving sustained support that they need to recover and thrive. We've heard today about vacancy rates as high as 30%, high turnover rates, and those numbers represent empty chairs where a provider should be sitting. And behind those chairs is a family waiting for help. My family's one of those families. I say this not just as an advocate for NAMI, but as a parent of a child with mental illness who spent 2 weeks in an emergency room waiting for an inpatient placement due to the absence of community services for him. The need for mental health and substance use services continues to rise, and yet at the same time we have federal cuts coming towards us that take away basic supports like Medicaid and SNAP, health coverage, medication access, food security. And we know firsthand that when a parent loses health care or a child goes hungry, mental health stability becomes harder to maintain for the entire family. That's why we're joining our partners here today to call for a 2.7 targeted inflationary increase to sustain essential mental health and substance use disorder services. It's not just a luxury, it's a necessity. It will help agencies keep their doors open, retain staff, and provide families like mine with timely access to care before crisis strikes. So on behalf of NAMI New York State and the thousands of families we stand with, we thank you and we hope we see this increase.
What do we want? 2.7. When do we want it? Now.